It is with great honor that I welcome you all to the inaugural CARE ETM conference. This virtual program will allow us to cross national borders to advance our goals, and I am so thrilled that today's online platform allows us not only to meet our amazing colleagues, but also the communities they serve.
The overarching theme of our conference is to provide a scientific basis for the traditional Asian medical practices that many of our patients use.
With increasing interest in integrating healing traditions into the practice of medicine, we seek to share the best and evidence supporting the use of these long-standing traditions in promoting health.
Historically, challenges in developing consistent research methodologies have hindered the integration of traditional practices into modern medicine.
And so all these challenges require a lot of thinking in the scientific methods and a lot of innovation in the design for such studies really to establish some of the reliable evidence.
We're going to try to focus in on some of the research issues that could help Asian medicine be integrated with Western medicine, as well as just the issue of Eastern medicine having its own base of evidence.
For those not directly involved in research, this is an opportunity to show the work that goes into establishing the evidence behind best practices. For those who are involved, this is an opportunity to discuss translating research findings into actionable steps for providers and the public.
The conference will consist of 3 days, each focused on many areas of interest, including nutrition, chronic disease, pain management, and mental health.
This conference was made possible due to a generous support of the Chi Li Pao Foundation and Stanford International Medical Services.
Dear Chairman, ladies and gentlemen, at first I want to thank for organization committee's invitation to let me have a chance to participate in this very meaningful web-based conference. It's really my honor to have the chance to be here to share with my research works. Today, my topic will be focused on the good publication network in traditional Chinese medicines.
Hello, everyone. My name is Liu Baoyan from the China Academy of Chinese Medical Science. Today, I will introduce the role of the TCM in the pandemic of the COVID-19 in China.
Hi, Namaste. I'm absolutely enthused to be invited by the first ever evidence-based traditional medicine conference that has been organized by Stanford. And I hope that I am able to share the very useful wisdom that lies in traditional medicine concepts by the focus on nutrition.
Namaste. I'm Vaidya Sheena Suraj. I am an Ayurvedic practitioner from India, from Kerala, India. So I'm presenting on the nutrition for preventing respiratory allergies.
Hi, my name is Randall Stafford. My goal is to talk about anti-inflammatory diets to prevent metabolic and cardiac disease.
In these thoughtful and informative sessions, our presenters talked about the development of a structure to look at and evaluate research, outcomes of interventions using TCM in COVID-19, role and rationale of anti-inflammatory diets, correlations between Ayurvedic nutrition and how this correlates to Western medicine, and the utility of diet and herbs in the management of rhinitis.
Good afternoon, my name is Jianfeng Tu. I am from Beijing University of Chinese Medicine in China. The topic of my presentation is efficacy of intensive acupuncture in knee osteoarthritis, a randomized control trial.
Hello, my name is Vrinda Devani, and my co-presenter is Geetika Kumar. And we are here to present our research on the effect of Ayurvedic self-massage technique, also known as Abhyanga in Sanskrit, with an Ayurvedic herbalized oil on perceived stress, sleep disturbance, and overall quality of life.
Today, I'll be talking to you about my work in predicting clinical response to acupuncture and placebo in treating chronic low back pain.
I am Vaidya Jayarajan Kodikanath. I have been practicing Ayurvedic medicine for more than 20 years. So glad to be here presenting some of our methodologies we used in the management of back pain and backed up by the evidences.
Namaste. I'm Anupama Kizake-Vittal, Professor and Program Director of Ayurvedic Medicine at the Southern California University of Health Science. So topic for today is Ayurveda for management for rheumatoid arthritis and evidence-based report.
Good evening, everybody. My name is Li-Xing Lao. I'm Professor of Acupuncture in the Virginia University of Integrative Medicine. The topic of my presentation will be evidence-based acupuncture on pain management.
I would like to take a moment to acknowledge that not only do we have participants from all over the world, there are a wide range of backgrounds, personal, educational, and professional here today. For some, this is the first introduction to Ayurveda and traditional Chinese medicine. For others, you have experience in one area or the other, or both. We have participants who have dedicated themselves to advanced research in these fields, those who provide care in many different contexts, and those who look to improve the health of themselves, their families, and communities. It is my hope that each participant will come away from the conference with something new, something to consider, something about which they want to know more.
Hello, I'm Barbara Niles, and I'm very pleased to be here. I'm going to talk today about evidence for mind-body interventions for post-traumatic stress disorder.
Namaste. Myself, Dr. Dinesh Kaiyat, a professor of Ayurveda from India. Comprehensive multimodal approach of Ayurveda for the management of children with autism spectrum disorders.
So today, I'd like to share with you about acupuncture and herbal medicine for the treatment of the psychiatrical problems.
Hello everybody, my name is Ram. As part of the mental health breakout session, it's my pleasure to talk about the work that we are doing on a comprehensive, individualized, systems-based therapeutic approach for reversing the cognitive decline in individuals with Alzheimer's disease.
And so we can see that both traditional medicine and also the Western medicine can be integrated, and they can be used to treat acute diseases like COVID, infection, and not just for prevention, but also the treatment outcomes can be evaluated using the same standard as those in the Western medicine.
But also how these specific strategies are tailored to individuals.
There's not one size fits all type treatments when we talk about traditional Chinese medicine and when we talk about Ayurveda. And that is a nice bridge into what we are hearing more and more about in Western medicine, about the idea of precision medicine, that we do want to tailor the approach to the individual. So we're treating the individual with the condition and not just the condition.
As physicians, we seek to understand the diverse populations we serve so we can help everyone live longer, healthier lives.
Thanks to all of you for improving the health of patients that use Asian medicines everywhere.